Hello everyone, welcome back to Community Medicine Insight. In this session, we will study home-based newborn care. Study this topic under the various headings like the objectives of this program, what are the different components, the number of visits, and what is done by ASHA in these visits. Home-based newborn care was launched in the year 2011 with the aim of accelerating the reduction of neonatal mortality and morbidity. So, neonatal deaths are the deaths which are occurring within the neonatal period, and this period starts from birth till the completion of 28 days. And the focus was more in the rural and the remote areas where the access to the healthcare facility is limited. And these guidelines were revised in the year 2014 to strengthen its implementation. So, the core idea behind home based newborn care is very simple but powerful to bring the essential newborn care from a hospital to the home and the most vulnerable period of life. Strategy is under National Health Mission, and in this the trained community health worker, particularly ASHA, provides the essential newborn care at home through scheduled visit to improve the neonatal survival. These visits ensure the early detection of problems and the timely referral, thereby improving the newborn survival. For this, the ASHA is given incentive of around 250 rupees. This slide shows the number of days during which the visits are being conducted. Case of institutional delivery, total 6 visits are conducted, and in the case of home delivery, total 7 visits are conducted. So, in home delivery, the scheduled visits are conducted on the day 1, which is the day of delivery, then on 3rd, 7th, 14th, 21st, 28th, and 42 day. And in case of institutional delivery, the visits will start from 3rd day, then 7, 14, 21, 28, and 42. So how to remember this? As we can see here, you can remember that a table of 7 is being followed: 7, 14, 21, 28, 42. Coming to the objectives of this program, first is to provide the essential newborn care to all the newborns and prevent the complication. Second is to identify and give special care to preterm and low birth weight babies which are at high risk of having neonatal morbidity and mortality. Third is to detect the illness early, ensure proper treatment and referral, and then support families in healthy practices and build mothers' confidence to take care for themselves as well as their newborns. The key components of home-based newborn care includes the essential care of newborn and the examination of the newborn. Second, the early identification of danger signs and referral of the child. Third is counseling of the mother. So, a mother is counseled on various issues like breastfeeding, how to keep baby warm, various hygienic practices are being taught to the mother. The mother is also told about the immunization of the child, postpartum care of herself, and the use of family planning methods. Home based newborn care, we are providing the clinical care plus preventive care, plus we are also giving health education. In essential newborn care, the focus is on basic life-saving practices. First is the thermal care. So, as we know, newborn are highly prone for hypothermia. So, bathing should be delayed for at least 48 hours and the baby should be kept warm. How the baby can be kept warm? By delaying the bathing, appropriate clothing that is 1 to 2 layer in summer, and 3 to 4 layering in winters, and skin to skin contact by kangaroo mother care. Breastfeeding is to be initiated as early as possible within the 1 hour of delivery, and promotion of exclusive breastfeeding is done. And the mother is also taught about the importance of colostrum. Cord care. The cord should be kept clean and dry, and nothing to be applied on the cord, which is a common harmful traditional practice which is seen in the rural areas, that sometimes they apply some oil or cow dung on the cord. In eye care, identify any discharge and antibiotic to be applied if required. For the infection prevention practices, hand hygiene is to be maintained and avoid exposure to sick persons. Then the assessment and examination of the newborn is done. In this, the general condition of the newborn is assessed based on the activity, cry, and responsiveness. The feeding pattern is seen, the adequacy, the number of time the newborn is breastfed. Vital parameters like temperature is recorded to detect any fever or hypothermia, and the weight monitoring is done. And the physical examination of cord, skin, and eyes is done to detect any sort of infection. If the cord is clean, it will look dry, no redness is seen, and there should be no discharge. If there is a redness and swelling around the cord, moist and pus is coming, foul smelling, then the cord is infected. Next is the identification of danger sign. So it is one of the most critical roles of home-based newborn care to identify any danger signs early. These danger signs include if there is any feeding problem, the child is not feeding at all, or there is inability to suck, lethargy or unconsciousness, abnormal cry, respiratory distress like fast breathing or chest indrawing, or there is some temperature abnormalities, early or severe jaundice or seizures or any sort of abnormal movement. So any of this danger sign is enough for urgent referral. Once the problem is identified, the ASHA provides the basic supportive care at home, such as maintaining the temperature, supporting the feeding, and in the case of suspected infection, a pre-referral dose of antibiotic like amoxicillin can be given. And the key principle is the early and timely referral to the health facility. ASHA also inform family about the various schemes like free transport and treatment under the government program that will reduce the delay in seeking health care. Low birth weight and preterm babies, they are high risk group. So they require more frequent monitoring, special attention to feeding, and kangaroo mother care, which provides warmth through skin to skin contact. And referral is required if the weight is less than 1.8 kg or some complications are present. Counseling is a cornerstone of home-based newborn care. On breastfeeding practices, they should be feeding on demand and approximately 8 times per day. And they are also taught about the importance of colostrum exclusive breastfeeding and not to bottle feed the child. Thermal care practices are very important to prevent hypothermia in newborn. So they are advised to cover the head, hands, feet with the cap and gloves. Hygienic practices are promoted. They are taught about hand washing and how to keep their environment clean. And hand washing is particularly important after defecation and after changing the diapers of the baby. Mother is also informed about various danger signs that requires urgent treatment. Immunization guidance is provided and they are informed about the first due dose of vaccine. Family planning counseling is done if the mother has not decided yet any family planning method. This will build confidence and improve the skills of the mother. In home based newborn care, it also emphasizes the care of the mother. She is being monitored for excessive bleeding, at using more than 5 pads per day. Is there any infection or foul smelling discharge that may indicate infection? And is there any breast problem like engorgement or cracked nipples? Then the mother is advised to keep the breast clean and lubricated in case of cracked nipple. In case of engorgement and breastfeeding more frequently and expression of milk. They are also taught about adequate nutrition and importance of rest and hygiene. Proper documentation is very essential for the monitoring and the continuity of care. So, records are maintained in the MCP card and home based newborn care forms. The total number of visits conducted, findings of ASHA, if any intervention done, all the things are documented. So, this will help in the follow up care, tracking of progress, and also for the incentive based payments. This is the card of home based newborn care and it is to be filled by ASHA and to be checked by a supervisor. To perform these tasks, the ASHA is provided with home-based newborn care kit, which includes a digital watch, thermometer, weighing scales, blankets, spoons, and medicines and consumables.